Good afternoon and welcome again to another session on the Digital Skills Festival with BCS. My name is Adam Thilthorpe and I'm Director of External Affairs at the BCS. And with me today to talk about professional credibility in a very crowded talent market, not only in digital but also in health informatics, is Mike Cavaye. So Mike, would you like to introduce yourself?
Hi there, I'm Mike Cavaye. I'm Deputy CIO at Surrey and Borders NHS Foundation Trust.
Thanks, Mike. So to start us off and get things going, of course, during a pandemic, we've seen, or it's been reported, a massive acceleration in the take-up of digital in health informatics and more generally in the round. Has that been your experience over the course of the last year?
Yeah. I mean, it's interesting almost thinking about it as a year. We've definitely seen an uptick in the adoption of technology. I will say that. Yeah, we've got more devices, more mobility out there, more home working, than ever before. I think from a truly digital aspect, though, what we haven't really seen is the promise of what we can do if we rethink models of care. And that's what's starting to be discussed. You see it more in primary care than you do in other bits of the health service, but it's becoming. But we haven't really delivered it through COVID. We've replicated what we've always done. We've just shifted where we do it from.
Yeah. So we've done, and there's all sorts of stats out there, and I've spoken to a few people about it. Adoption of home working has driven a certain amount of what I would call sort of, I don't want to be flippant, but delivery of facilities type issues through digital enablement, which is great. It's really important that people are able to work from home where possible. But I think you're right, we haven't made good on that hopeful promise of what revolutionary sort of digital healthcare might mean. But you say you're beginning to see glimpses of that, beginning to see conversations at least.
So I think one of the things that COVID has done is kind of sped up the conversation about integrated care, and integrated care drives the digital agenda very nicely, because it's all about reimagining our clinical services around the person rather than the organisation. And if digital has any part to play in it in this sort of new world, it's really driving the practices and the culture shift that really enables us to deliver the integrated care agenda with effective technology that really enhances it rather than hinders it.
Yeah, and does that put more pressure on you and your teams?
Yeah, so I think the one thing that and then it's easy to say, isn't it? COVID's kind of opened people's eyes to the fact that actually some simple stuff can be solved by technology. What that's then done is that hasn't got away, and as we've gone through restoration and sort of back into a slightly more normal sort of scenario, all of the other pressures have come down on top of that, and then there's now this belief of opportunity that's kind of there. The other thing that we're seeing quite a lot of is because we did so much so fast during COVID. Yeah, the idea of the shiny thing has really come into the conversation, and we just need to adjust people into the place that says we did a lot very quickly in COVID. For one, we dropped everything else, but two, we didn't make them sustainable. We did a lot of prototypes, and we delivered prototypes and betas into the real world. We now need to retrofit some of that, and we need to make it sustainable. How we start registering that we need different building blocks to come together for the agenda that we're now being asked to do, I think is really important.
Yeah, and culture. You mentioned culture there. What have you observed sort of significant cultural factors that are happening now with as I know that your team and you will be focused on digital adoption to as ever thus. How has that manifested? How has that cultural shift sort of manifested across? It might be clinicians, but it might be further afield than solely that, and maybe even the pressure coming from patients.
Yeah, I mean, so again, I mean, so there's nothing quite like the consumer, if that's the right way to describe patients, which it probably isn't, to sort of drive choice and preference and wanting stuff differently. And I think that's seeped in through the COVID period a bit. I think the other thing is there is just a recognition across our clinicians, our workforce more generally now, that they couldn't deliver some of the stuff that they were doing previously, and therefore they now need to think differently. And because that's started, it has created that almost awakening that they can do things differently, and now to revisit it. I think one of the things that we have seen a little bit of, though, is the sort of the challenge, because we've not done the transformational rework, and we haven't done that sort of pathway redesign or understanding when it's appropriate to use technology or not to use technology. We kind of got a bit of friction there, but we've also got the opportunity to take the people that are now a little bit frustrated on the fact that, what video conferencing isn't appropriate for every patient cohort, and sort of bring them into the digital conversation, which is what we're seeing quite a lot of. We're quite lucky in our organization because we've kind of been on this journey for a few years, and we've been creating a sort of fusion multidisciplinary teams to look at our digital transformation over time anyway. And what we're seeing is lots of people sort of stepping up now to want to be part of those conversations, both from involved in project work to one descriptor, but also to be that digital leader within the operational clinical areas, and that's an exciting prospect, because we're moving from this place of IT and digital being something that you engage people with to something where they're involved in it. And I think that's the real opportunity cultural shift that we've had off the back of COVID.
It sounds like you're even prior to the pandemic, you were relatively well down this track and advanced in the stage. But what has this meant for the credibility of your team and what you say? I mean, often while you think of your answer, it's been a problem in the past is that if IT can very easily become the department of no, and then amazing digital stuff happens around them to get around the problem, which is the IT department. Which is 9 times out of 10 completely unfair. But there's been that sort of culture. How have you been able to, I guess pace of delivery helps with credibility in some people's eyes, but then going back and revisiting and talking about the very sensible things you've just discussed around revisiting those pathways and making sure that there aren't unintended consequences of the pace of your delivery. That puts an extra strain on it as well. So what do you do about credentialing in that space?
So I think what's interesting in this in the digital space, in the traditional IT space, getting skills and creditations and all that type of stuff had a value. Wasn't very transferable. When we start talking about digital in a way that says, and you break it down, and everybody has a bit of digital skills, and you bring components of people's sort of transferable skills and their history and their day-to-day practice into this conversation, it becomes a lot more blurred, and it becomes a lot more challenging for us to work out the relevant components and bringing those up to a relevant standard. So one of the challenges that we have is as we move out of, and for me, on a personal reflection, as you move out of an IT focused agenda into a place where you're really talking about transformation and clinical transformation and whole systems transformation, how do you have the pedigree or the authority to really speak in that space, and therefore how do we prove that? And I think that's why credentialing becomes important, or professionalization becomes important, because you need to become that trusted professional, not for the technology aspect, but for all of these other areas that you now need to be able to influence and convince people of. And and then you need to bring a broad spectrum of multidisciplinary or portfolio careered individuals into that sort of space as well, because it's the power of the team and it's the power of the collective that really makes digital work, and it solves some of those other areas that we worry about these time at the moment in terms of bias or inclusion and exclusion, and and ensuring that we have the relevant diversity in what we're then producing or building.
Yeah. The more diverse the team, the better the outcome. It's quite. How do you do that then? How have you started to do that? Because that is, as you say, that to me is the difference between sort of traditional IT used to be keeping the lights on, but digital is more than running the business or even changing the business. It's often saving the business from itself. And in your context, that's reimagining what, I don't know, what a hospital might look like. And there's a huge amount of legacy that comes with that in bricks and mortar and actually theatre and operations and all that kind of stuff. But actually, how do you credential that you are part and parcel of that vision for the future?
Yeah, and the answer to that is we've got to start somewhere. Yeah, and this is the challenge. You know, if I was a doctor or I was a nurse, you know, huge professional organizations and capabilities have been built up over many years. You know, and what we're trying to do here in technology-driven change or transformation or any of these areas is kind of grow a professional cadre of individuals at a rapid pace because we need it. We need it because, you know, some of the ethical decisions and dilemmas that we're going to come up with in the very near future, associated with AI or some of the sort of decision tools that we're going to create, if not have already created, need to be understood, and the values and the way that we work need to be understood. And to start, therefore, we've got to start saying, what are we? Yeah, so to give some focus to what we are as a profession, the value that we offer. This is difficult in this particular space because you know, most people that work in a digital space or in a health informatics space or a clinical informatics space tend to have other careers. Yeah, if you come from a technology background, you know, you've got a conduit. But if I'm a surgeon and I'm coming into this space, I've already got a profession. Yeah, and if I'm a nurse, I've already got a profession. And how do I therefore create the right mechanisms and the right professional understanding of competencies that enable me to understand that I can have multiple professions, and I'm sort of growing that to a defined standard, no matter what my background might be. And I think that's where you know, the agenda has grown. You know, we've created some organizations in the Faculty of Clinical Informatics and in terms of FEDIP, which starts to bring together the right focus of the conversation around what do we really mean by health informatics and what is the standard and the competencies that we require for that. From that, you can then drive a really meaningful conversation about what our pathways are on profession. How do we move from what is a trade currently, crudely, into a place where we can be trusted professionals?
Yeah, and I think that's something that I've sort of spoken around and seen firsthand working in the BCS, is that the point of organisations, not just sort of Federation of Informatics Professionals you referenced, the FCI, and the BCS itself, is, especially with organisations such as ourselves with the Royal Charter, we exist for the benefit of the public. We're not a membership club for the benefit of members. Now, we need members to be able to talk with authority around these issues and to have a mandate to be able to discuss those items and show sort of equivalence, if you like, to other professions. But our job is actually around the public task, in the same way that surveyors can't be, you can't just get loads more surveyors. If you've got a hole in the roof, every surveyor is going to say you've got a hole in the roof. You know, at the moment you could put out I don't bring up the National Database for Health, but there are various different ways that you could test that hypothesis of professionalism within IT, and sometimes find it wanting. So it's incredibly important. Where do you talked about people moving in and out and having different sort of portfolio careers. How easy or difficult is it to find talent for the teams? There's huge pressures coming down the line. I think we can both agree that the pandemic has changed people's attitude and regard for sort of health informatics, digital in healthcare. It's not going to go away. In fact, more is required. How easy is it to find talent in this space?
So I think there's a couple of elements to that. There's how do we register that there's you know, and especially in the health informatics space, how do we capture the pipeline of talent? How do we look at, you know, the careers, you know, the careers fairs or the universities and the schools, and we're understanding the talent that's coming through there, and we're making a brand that you know, in a trusted place that people really want to work, and we're creating you know, the sourcing mechanisms from that pipeline, and we're supporting it so people go, you know what, Facebook, yeah, kind of get that, but you know what, the NHS, health informatics, whatever it might be, is actually, this is a good career path for me, and I really understand the opportunity of things like the data that I can work in my professional career and where that might set. So there's kind of that element, which is really, really important, and to be honest, we don't do very well. There's then there's this area that we really need to remember, that the skills and the capabilities that we need today aren't the ones that we need tomorrow. So how are we creating the fluid capabilities and the reskilling programs and the development programs that we kind of need to enable people to work and to develop? I think there's a sort of a subset of that for me that says, how are we giving people the opportunity to then apply those skills? And a lot of the formal mechanisms that we've had in history in terms of the way that our workforce is structured, especially within the NHS, kind of prevents that. So how do we create opportunities for portfolio or gig working or whatever the nice buzz title is these days, to really deal with that? But there is also these huge skills gaps, and we know the obvious ones: data science and user-centered skills and these sorts of areas. So how are we looking for people that have the right mindset that we can bring into the workforce, that we can, business knowledge is the hardest thing to learn. So once we've got people within the health space, how do we bring them in, and how do we create the ability to use the talent that we've got, but in this particular space?
Yeah, and do you see that's interesting. So we see with sort of with nursing, with midwifery, with other areas, the sort of the growth in sort of digital literacy, if I might say, around and clinicians more broadly, has actually led to a sort of a change in requirements. So we need that cohort of people, that cohort of talent. But we actually need to have a shared understanding of what we mean by some of these terms that we've been banding around already, whether it's IT or AI, machine learning, whatever it might, well, digital even, whatever it happens to be. And there's a thing in there. It's more broadly into. We talked about Facebook. Facebook is essentially an advertising monopoly. But during the pandemic, we've seen people sort of relying on it to do the things that it always purported to do in the first place, like understand how we do provide sort of social care in our communities, potentially. People organise by street. But how in the future are we going to be able to, as you say, get those people excited and motivated who want to do great things in those areas into the NHS? How do we solve the problems around data, not even the data, but the trust between patient and healthcare provider? I want to, maybe in the future, we're going to see a world where I want to donate my health data anonymously to Cancer Research UK. And I want to do that through the NHS, because that would surely be the organisation I would trust the most with regards to my private healthcare data. But yeah.
Yeah, I think this is why the professionalization agenda is quite important for anybody who works in health informatics, because for us to maintain that brand within the health service, or to build on that brand in this particular space, we've got to be able to speak with authority. We've got to speak with a value trusted voice, and how do we start to create, so we're not the receivers of policy, we can inform policy, and we have the authority to go and speak, to drive this policy, the policy agenda. How do we recognize that we have good career paths and development there that really enable us to say, I am at this level and therefore I am capable and therefore you can trust me? And how do we drive the continual learning cycles that we require to maintain that to a particular level? So, I mean, the take I kind of take on this is, at the point where, the NHS app is, the COVID app is kind of relatively recently sort of gone through all sorts of troubles and difficulties and all that sort of stuff. But where is our professional body that somebody came to say, is this a trusted, are we comfortable this is a trusted app? And we can speak with authority that the population at large go, you know what, that's a voice I trust, in the same way that you would with the Royal College of GPs, or you know, some of these other sort of professional bodies that kind of come to the fore. And if we can build in these areas that level of public consciousness of what we are and what we do, actually that and will permeate back into the way that we work on a day-to-day basis, and it'll mean that we also have the authority to go and talk to the population and continue that trust and that ethical sort of conversation of what is it right and what is not necessarily right, or in what circumstances are things right when we're dealing with data, when we're dealing with algorithms, when we're dealing with technology.
Yeah, and of course with that trust comes with sort of responsibility and accountability that comes with what we would argue, I think, is just being a professional in the first place. Sort of it's part and parcel comes with it. On a practical level, then you've got a clear vision. You've got it's a grand vision. It's very altruistic, and it's it's going to have to happen at some stage. Really, if you look at sort of 10, 15 years down the track of where health and social care needs to be, it's if as much as anything else, it needs to be digital because it's what we might be able to afford as much as anything else. I mean, there are some practical issues as well. Practically, what have you done then with your teams to start them on that journey? Are you active talking about adoption of standards, registration, talking about some of these professional bodies? I completely hear you when you say Federation of Informatics Professionals and others needs to step up and be that trusted voice, not just to your profession, but actually for it to be relevant to your profession, it needs to talk to the population at large as well. So that message is loud and clear. But what have you done practically with your team?
Yeah, so you know, the first step of some of this is just to recognize the fact that we've got to do it, right? So that there is, you know, and then there's adjusting the conversation from you know, professional, you know, that grand vision that we've kind of gone through, to what does it mean to me as an individual? Yeah, and for me, the best place to sort of describe the need, the professionalization conversation and the way that needs to develop is fully aligning it to the learning agenda. Yeah, so you know, the evidence out there on learning to earning and all that sort of good stuff of you know, as you continually develop your skills, you know, your potential for earning sort of develops, and the value of that to organizations becomes really important. So for us locally, what does that mean? It means we've started this conversation about getting registrations and validating the skills and competencies that people currently have. And you know, we've done some of the RITEC stuff through BCS. We're going through the first round of FedEp sort of registrations as well. And from a senior leader sort of point of view, we've now got 3 CHCIOs from Chime via BCS, and that creates that sort of digital leadership bar, if that's the right way to describe it, that I think is a really important sort of stake in the ground. But all of that, you know, and it gives you some credentials, it gives you some validation of trust and that sort of stuff. But it's really only just the beginning. Yeah, and what's interesting for me is the way that just having this conversation has developed a conversation about motivation, if that's you know, and how we and motivation is all about discretionary effort, isn't it? So you know, so if I can keep the teams motivated and I keep them connected and I can keep them learning, then they're going to be more motivated and I get something out of it from an organizational point of view. But it also enables us to start having the conversation with our teams about the various skills that they have, about the, you know, the opportunities that they require, and it's been really interesting for me watching the teams suddenly caring about their learning again, where it's very easy in healthcare organizations to just think I'm here to do a job and nobody's ever going to invest in me. And we've kind of broken that cycle a little bit. It's not you know, it's not the perfect place by any stretch, and you know, money's still tight and that sort of stuff, but we've got that conversation going. And you know, so much of learning is not formal education that has a huge cost on it. So it's, you know, so driving that conversation through the professionalization agenda or the registration agenda has been really powerful.
Yeah, no, that makes a lot of sense. One of when I first started getting involved with sort of health informatics, and it was a fair few years ago, one of the criticisms and one of the things you could actually observe was that health informatics was other. So it would not learn lessons from Specsavers about how to do appointments because they're Specsavers and didn't understand, or British Airways, or the military, or whoever. In fact, military is probably a bad example. They were a bit closer, but it's, you know, what was happening in private sector sometimes didn't transfer over. Now, with context is king, and actually people engaged in the public task there is a different motivation, but actually we can learn lessons and therefore reduce our mistakes by learning those lessons, by that cross-fertilization of ideas. Do you do something? Has that changed, and how do you go about sort of reinforcing some of those things?
So I mean, cross-sector learning, cross-industry learning is a really interesting one for me, because you know I deal with Gartner quite regularly, and you know and even the BCS, you know, those cross-industry insights are so important for where we are in health. Yeah, because so many more industries have you know, are quite a bit further ahead, if we're really honest with ourselves, and we can learn a lot from that. And actually, we can learn from the mistakes of that probably more than anything else, and that's really, really important. And you know, so therefore, you know, from a local perspective, as we start to develop, you know, not dealing with the legacy, you know, getting out of the legacy problem that we've dealt with, and we're starting to talk about how we define digital platforms for the future and what they look like and the competencies and capabilities that we need to be providing. You know, a lot of that is really, really important that we learn what's gone on elsewhere. How we apply it for health is why health informatics is slightly different, and that's the key that we need to professionalize. So that's why health informatics is a profession in itself. And yes, you can be, you know, CITP, and you can be, you know, you can be a top end IT professional as well, but health informatics is in the health context. You know, for that public mission, the mission is different, and that makes it a slightly separate profession.
I completely get that. And do you see in the future, by adoption of these standards and registrations, actually will help you to get people in and out of, because actually I think it's a good thing for people to come into the NHS, maybe work in health informatics, go out, do private sector or whatever, come back in. There's various tiers and levels throughout their career. I don't think that would be a problem. I think, in fact, that would be hugely beneficial for both private sector, public sector, and everything in between.
Yeah, I think one of the things to really recognize about health informatics and digital health is that we have, you know, we need to create the mechanisms that really recognize that people have other professions. And you know, we want people to, you know, so we can't create a whole world of professionalization that isn't connected to the rest of the world, because that creates a very small pool of resource, you know, and creates the barriers to connecting to it. You know, if I'm a nurse, I have an identity as a nurse. You know, I can also be a digital nurse, and that's quite exciting. If I'm a IT network engineer, you know, I'm an IT network engineer, but I can also be a network engineer in the health informatics space. Yeah, so you know, we have lots of different pools here of lots of different sort of identities and capabilities that we're bringing a commonality together, and that's the standards and competencies that we need to see. But we need to really, really be aware that what we want is to, you know, bridge, you know, create a capability to bridge the talent pools from wherever they happen to be. Sometimes that's within the health service, quite a defined area. A lot of that is how do we bring people in from wider industry, and there's real power for that. Yeah,
and I guess that professionalization and registration agenda through some of those bodies gives you that equivalence. Once you've got that equivalence, then you can say, right, my expertise is a sort of third party endorsed given, and therefore we can start talking about sort of the vision of the future and a sort of shared understanding of what that might be. Trust your credentials that when you speak about those IT or digital issues, it comes from the right place and the same motivation that they would bring to the table.
Yeah, I think one of the big things that we've also got to address is to create some clarity on some of the pathways of, you know, the journeys of people's careers. You know, so you know, and to really signpost people through what at the moment is quite a void. You know, how do I get the right skills? How do I get the right experiences? How do I get the right credentials? And you know, as we professionalize, if we can create the view of that. So, you know, the equivalency of being a lawyer, if that's a terrible way to do it, to describe it, is then we start to be able to explain what is a complex environment a little bit simpler, and we can bring people on that journey.
Yeah, my default in those sorts of conversations, regardless of sex, has always been Sophia, the Skills Framework for Information Age. It's useful because it's not solely about one area, but that's where again you can think about what skills do I have, and therefore where could I go, as well as I need this role at this level, and therefore what skills do I need. So you can look at it in two ways. What's your sort of finally, Mike, if I may, so we've seen this acceleration of digital adoption. That's not going away soon. What do you think the health service, what do you think the NHS is going to look like? What does a fully enabled sort of digital health service for health and social care? And social care is an element I think we're aware is ripe for digital transformation. But what do you think, very briefly, that looks like? What's your sort of, if it all goes swimmingly, what's the golden vision? Where are we going? What does utopia look like in this space?
That's interesting, isn't it? I guess for me, from what I'd like to see is the shift from organization centricity and fundamentally clinician centricity to a place where we really put the person at the heart of the care that we're providing, be wherever that is in the system, and we start to drive personalized care associated with that. And personalized care comes from really understanding that individual. That's a data conversation. That's how do I understand who and what you are, you know, your story, your I work in mental health, so how you're feeling and your wider story is really important to the way that we actually deliver care. And if we can capture that, then we can really redesign our clinical care or our well-being offer around the individual. And you have the choice, therefore, to engage with things in different ways depending on how you trust. So that if that's the future, we've kind of got this, how do I create the platforms and the open architectures that really enable me to do that, and how do I have the skills and the competencies and the professionals that are really trusted to provide that. So at the point where I'm personalized care doesn't fall down because suddenly people worry about what's happening to their data, because what we're talking about here is much greater data than we hold today, and that's quite scary if we don't manage it appropriately. But it's also the huge opportunity to really transform the interventions or the drugs or the delivery of care to you as an individual.
Yeah, and I guess that's where the professionalism piece, again, we can't achieve that. The level of trust required to do that is really quite high, and that's where I think the professionalism agenda is so important, because that's what that's trying to address, and then that allows people to fulfill on this hopeful promise of what digital might be able to achieve. Okay, Mike, it's been fascinating talking to you this afternoon, and I know we could go on, and maybe we will, because I might sort of see if we can't do a follow-on with you as well, which would be really interesting. But thank you so much for your time this afternoon.